Perfect. Okay. I think first step was announcements before we get to the meeting minutes from last month. Is there any announcements, Larry?
Well, there really isn't any announcements. I do know that there's quite a bit of activity going on COVID related. So I'm sure people will share updates and possible upcoming COVID related announcements when we get into the agenda, if you don't mind.
Yeah, no problem. Okay. I believe next on the agenda is meeting minutes because my other screen just froze. So does anybody have any changes or updates or anything to the meeting minutes from last month?
Madam Chair, this is Arlette. I move to approve.
Thank you. Is there a second?
Rickstein seconds.
Perfect. All those in favor say aye.
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 Any opposed?
Aye.
Okay. Thanks, everyone. Okay, so I think we're moving right in then to COVID updates. I think contact tracing was first, right, Larry?
Yes, that is correct. I thought I'd take the opportunity to give a brief update on contact tracing. Outside of my regular public health duties, I oversee our contact tracing group and wanted to make sure the Board of Health was updated on anything new. We currently have 28 contact tracers who are currently doing case investigations, most of which are full-time. We do have some part-time contact tracers as well as outside of our 28 contact tracers that pretty much work full-time. We do have public health staff also that are trained to assist when needed in contact tracing situations, such as if we get spikes in cases or if we have a significant number of contact tracers out because of illness or other reasons. There are some individuals that we could pull in and have assist us. And I know sometimes that can be a little confusing for the general public, especially during the times that we're really busy. Why can't you just pull in, all your public health contact tracers as well, which we can and we have throughout the pandemic a few times. However, it tends to be a domino effect when we start doing that because many of these public health contact tracers are school nurses, they work in environmental health and a variety of other programs. And when we need to pull them to do contact tracing, their programs, their regular programs, can take a hit and it can impact those. So, it's nice to have them, but we do use them with caution because the last thing we want them to do is to affect our other important public health programs. Currently, our contact tracers are still working 9 a.m. to 9 p.m. That's our hours of operation, 7 days a week, including holidays. Just before the meeting, we were briefly talking about, it's hard to believe that Thanksgiving and Christmas is just right around the corner, and we will have a smaller staff, but there will be individuals working in contact tracing just to make sure that we are continuing to meet the community needs and people are available to answer questions that our community may have. As well as it's important to know that our contact tracers, continue to follow the guidance from the North Dakota Department of Health, and those guidelines do change periodically. We just recently received an update, so it's important that they keep updated with the changes in contact tracing. Most recently, and probably the most significant change has been our case investigations. Our contact tracers were spending a great deal of time reaching out to close contacts, which on average, our cases were taking about an hour per case on average, which that led to some of our backlog throughout the state. So as many of you probably heard, that we needed to make changes. So we are asking individuals that are positive for COVID to reach out to their close contacts. Now our case investigations are taking more like 10 to 15 minutes. We do provide informational fact sheets to individuals who are positive. We do educate them on what exactly is a close contact. We're able to provide some scripts to them, because for some individuals it's hard to know how to actually bring up, hey, by the way, I'm positive, you've been a close contact to me. So, we have to do some education to individuals related to that. With that, close contacts or anybody in our community can always call our contact tracing call center at 241-1587. If they have a question or wondering where they can get tested, and so on. Again, there are about 28 contact tracers, mostly full-time, and they're doing a great job to help slow the spread of COVID.
So, Larry, this is a Rick Steen question.
Yes, Rick.
Thank you. So I'm just curious, if we're leaving it up to the individual who's tested positive to contact their contacts, do we get a list of that so we can never follow up, or we just do we assume then that the positive tester is actually doing what we asked them to do?
We do not get a list at this time. Could that change? There's talk that in the future it may, but just with numbers spiking extremely high so quickly, we're hoping that the individuals, do take it upon themselves and are responsible enough to let their close contacts know. But at this time, we do not follow up to ensure that, yes, indeed, these individuals were contacted. We hope that they will do that on their own. And we do, part of our job too is to make sure that we explain the importance, because it is important that they do know to slow the spread, but we don't follow up on that.
So we can verify then that the positive tester is contacting anybody, really?
No, at this time, no.
All right, thank you.
Yep, you're welcome.
Larry,
Oh, go ahead.
This is Arlette. The last I heard, at least the tracking that you were doing, it was about 50% community spread. Are you still trying to, it sounds like your contact tracers have turned more into an educational focus, less of contact tracing. Are you still collecting, though, where individuals may have gotten it, or is there any data coming from that side?
Arlette, that's a great question, and I wonder if Breton might be a better individual to answer that question related to the data and where people are acquiring COVID.
Thank you, Larry. And I can talk a little bit about contact tracing and case investigation. Just in general, they are two separate components. We are still doing case investigation. Case investigation is talking to the case, educating them, and trying to figure out where they may have gotten it. We may not necessarily be documenting that. Since we aren't documenting weddings, we are going to start adding those activities back in right around the holidays, just because we know people are going to be going to Thanksgiving and Christmas holidays. And then to kind of expand on Rick's point about verifying contacts, whether or not they had contacted them, it was no different than whether or not they told us the truth on who all their contacts were. So we were relying on personal responsibility of the person to tell us who their close contacts were. And most of the time, by and large, we are finding that people who told their contacts were readily available, had already told their contacts they were close contacts prior to us reaching out. It's those ones that wouldn't tell anyone anything that probably still aren't telling us or telling their close contacts. So I don't think that that process really changed anything. I just wanted to add that piece.
Brenton, so are you seeing any changes in community spread versus with your case investigations versus specific source?
It's just 100% unmitigated community spread. We have so much community spread. We have 200 plus 300 cases a day. It's really, by the time we get to a case, when talking to them and talking to the contact tracers, many people have 2 or 3 separate exposures. So it's really difficult to determine whether or not or where they got it exactly, because they may have gotten it at work, they may have gotten it in their own household, they may have gotten it in school. So pinpointing that exact point of where they got it is not as important as getting that person isolated and getting their close contacts in quarantine.
Chelsea, if I could ask one more follow-up question, and then I'll be quiet. So and this goes into the whole funding issue. I'm assuming the funding that dries up the end of December, we probably aren't going to see the federal level kicking in anymore. At least that's what I'm assuming. Is there another source to continue this work? Do you know, Brenton?
I can answer that.
Okay.
Currently, we do have a grant for $600,000 that starts on January 1. At the level we are currently spending, that will last us 2 months. We have met with Kent and Bruce and Mike, and they are looking at funding sources to hopefully bridge that gap until there is more federal funding or state funding or wherever it's going to come from. And I personally think we will get funding. I just don't know when. So I think the city's prepared to take that on in the meantime. And that's where we're at right now with that.
Okay, thank you.
Okay.
Have questions?
Any other questions about contact tracing?
Larry, I assume that this is the case kind of statewide as far as the process that you all are doing and just contacting that one individual and not following up, that's statewide, not just something that we're doing in Cass County.
Yeah, that's a good question. When this new approach started, we had a huge backlog of cases throughout the state, and like Brenton mentioned, it's most important to get to the positive individuals as quick as we can and hope that they will take personal responsibility to notify their close contact. With that is the minimum that's expected for everybody who's doing contact tracing in the state of North Dakota to do. From there, we can build upon there. So some are doing more than others. So one thing as we move forward, Brett and I and others will continue to meet, and we have gradually added a couple things already, and we will continue to do that once we find a need for our community.
Okay. Great. Great. So that's it on contact tracing, just in general. I think other COVID updates that you have, Larry, or other members of the team that you want to share?
Yeah, I invited or asked a few individuals to participate in the meeting and just share some updates and what they've been involved in related to COVID. And there's others that maybe aren't planning on speaking, but are available for questions. I did ask Chris Oman from Environmental Health to join. He has been involved with some of the questions and even maybe some of the concerns related to enforcement, especially with the new governor mandate. So I'm going to ask Chris to maybe share what he's been involved in. I think it'll be an opportunity for any board members to ask questions. So I'll let Chris take this part from here.
Yeah, thanks, Larry, for giving me the opportunity to come and join you guys. So since the beginning of the pandemic, I've been directly involved in either logistics or the COVID business response team, both myself and a few coworkers here in environmental health. Essentially, what we did at the beginning of the pandemic is we offered assistance with workplace assessment, social distance mitigation steps. We worked with large events to try to mitigate as much risk as we could, even though that they were having gatherings. So recently, the mayor introduced an executive order last Friday that was then amended to match the state's executive order that was released Friday evening. And now we have set up a COVID business response hotline, essentially, where people can call in with concerns or questions about the mandates. And you can reach that number. It's 241-1346. Myself and my coworkers all have access to that 24/7. And so what we do is we take those concerns, if it's an occupancy limit thing, a mask thing, just no social gathering concerns, then we'll reach out to those facilities and educate them on what the mandate means, what they have to do, and if they continue to essentially not conform to that, then we'll pass those concerns on to our local police departments, and then they can follow up at their discretion. Mainly since the mandates come out, it's been a lot of questions. People are confused. We've been suggesting 25%, 50 people, whichever number is less in any of our facilities under the orange restrictions. The governor's office has increased that to 50% or 150 people for bars and restaurants. So a lot of people are confused with that, and we're having to educate on those practices. Not a whole lot else has changed there, but our large gathering and event spaces has changed as well. There's now calculators where if you have enough square foot capacity, the state is allowing venues like the Fargo Dome to have approximately 1,000 people seated at certain venues. So it's just a lot of education on our part to give to the community, and then follow up with concerns presented to us. Since the mandate began, 3 concerns have been brought to our attention. I guess we were thinking maybe some of our bars were going to be chronic offenders, and we're not seeing that. It's a lot of retail stores that aren't conforming to the mask mandate that the acting health officer has implemented in concert with the new executive order. So just calling facilities, educating them on what they have to do is the big thing we've been doing since Monday.
Excellent. Thank you, Chris. Questions for Chris?
Madam Chair, this is Arlette. If I could ask Chris a question?
Of course.
So that hotline, Chris, is that where, I'm thinking bars, restaurants that are not following the guidelines, is that where an individual would call to register a complaint?
Yes. So that hotline isn't manned. It's just a voicemail, and the instructions on the message indicate that. And so any complaints are directed there. If someone calls dispatch, environmental health will be the lead in terms of providing education. So we'll start, and then if we have to, we will then notify our contacts at the police department and let them know of what's being brought to our attention, and they'll put it on their shift notes and provide that to the local beat officers to make sure that they're keeping that in mind, that they should check on those facilities.
So, Chris, one more follow-up question, if you don't mind.
Sure.
So, do you know the process on the police department side? I'm assuming, I just did a ride along, so I'm assuming these calls are probably at the bottom of their list. Is that correct?
So the police chief has indicated that they will do everything in their power to get to these concerns. They have limited resources as well. Our conversations together have been primarily education is everyone's goal. We hope that these facilities will adhere to the mandate of the governor's office, and then also locally due to the fact that their liquor licenses could be affected by it. So far, we haven't had any concerns brought to our attention from restaurants and bars. So I guess until we get one of those, I don't know what the priority is going to be in terms of the law enforcement aspect of it.
Okay, thank you.
Okay. Other questions? Quiet bunch today. Larry, anybody else on the team that is going to give an update?
Yes, Suzanne Schaefer, our director of nursing, has been quite involved with vaccine planning. And I asked if she would share with the group what she's been working on, and have an opportunity for Board of Health to ask her questions.
Perfect. Thanks.
Good afternoon. I have been working with a team here at Fargo Cass Public Health in regards to our COVID vaccine planning. So initially when this was brought to us, or we knew this was going to be coming up soon, our guidance was to have a plan ready to provide vaccine to the community by November 15th. So we started that process in October. We met with local health systems as well as Clay County Public Health, and we're actually scheduled to meet with them, that same group, again next week. We're currently meeting one-on-one with long-term care facilities in our county, just to assure that they have their vaccination plan in place and to answer any questions that they may have. And part of that is us promoting the use of pharmacies within their plan to vaccinate their residents and their staff. And then local public health would be a secondary backup to that. And also part of that discussion has been to try to assess what the estimated uptake would be for staff and residents, as we know that vaccine hesitancy is going to be a barrier as we move forward through this process. Although the efficacy rates have been promising, we know that this hesitancy will still exist. And so we will be working closely with Holly Scott, the communication specialist here at Fargo Cass Public Health, to share with the community some education that will help in dispelling some of the myths and misinformation, disinformation revolving around the vaccine. So I mentioned that we were supposed to be community ready by November 15th. Of course, that timeline has changed. We have since passed that. And yesterday, the updated guidance we received was to plan for vaccine arriving in mid-December. And then this morning, it was announced that Pfizer officially applied for their EUA, their emergency use authorization this morning. Planning moving forward is based on priority groups, and the initial outlook is that we will be starting with direct care healthcare workers. Most of the facilities will, the healthcare systems will take care of that for their own staff. Once this EUA is applied for, which now we know our first vaccine has done that, then the ACIP, which is the Advisory Committee on Immunization Practices, will meet, and they'll provide additional guidance as far as priority groups moving forward. And then once those groups are identified, we will we'll follow that. We'll follow those groups until we ultimately reach the general population phase. We do not have a timeline as to when that may be. Fargo Cass Public Health is working to set up a static site in the community. We're still finalizing those details, and once that's all in place, we will, and once that plan is formalized, we will share that moving forward. We just don't have any of that today to put out. Our intent is to start with a smaller site based on information that initial allocations, we're not sure how they're going to be, what the flow of people may be, and if it is primarily healthcare workers, Fargo Cass Public Health wouldn't have them probably immediately. We would be more that backup piece. So we're going to start with a smaller site, and then as our operations grow, so would the location. So Hunter Hubrig, in our emergency preparedness staff, has been and continues to be instrumental in working through this planning process. He's been really, really helpful. He's recently met with the emergency manager for the city of Fargo, the city of West Fargo, as well as the county, to establish a longer term site for when the larger allocations for our community vaccination becomes available. Within our building, we have set up an organizational structure with identified leads, and those leads are working to assemble a larger team, which will meet the needs of the community once the vaccine is available. Although the formal vaccine planning really started here just a couple of months ago, we knew at the beginning of this would be a really large part of our response, and so we'll be ready when the time comes to serve the community in this area.
Thanks for that update. Do we, I know there was a big push last time we talked about folks getting their flu vaccinations. Do we have any information on how successful that push has been prior to and leading up to the COVID vaccine availability? I know there's a big push.
I don't have the exact numbers. I will share that I have heard from the state that the numbers that we've had have been, people have been vaccinated earlier in the season than they typically have, and that our numbers have been good. That's been a couple of weeks ago since I've seen that. But I do know that initially the push and the uptake within the communities has been pretty good.
Okay. Great. Questions from folks? So you mentioned the pharmacy piece. So I assume that's tied to kind of the federal government coming out and saying that I think it's CVS and Walgreens are going to be part of this in some way, shape, or form. So you're back to the pharmacies. Was I interpreting that correctly, or?
CVS did have a federal contract that came through for them. That is really only for long-term care residents. Okay. So that is not the staff. And so many of the local pharmacies have contracted with the long-term cares to be the enrolled provider. And so they will get the vaccine, they will do the storage piece, they will bring it and vaccinate their staff for them.
Okay. Thank you for clarifying that. Great.
Madam Chair, if I could just ask a question. This is Arlette. Suzanne, what access do individuals who can't afford or don't have insurance that covers vaccines, what happens there?
Our intent with the initial with the vaccine itself doesn't have a cost. There are admin fees that can be charged in that. With this the initial phase of getting vaccine out, we have made the decision to not charge those fees, as we really need to push through to get this initial phase in place to protect our community and get the best immunity out there possible. So at this point, that's our plan moving forward.
Sounds great. Thanks.
Okay. So you won't bill anybody administration fees, or just those without insurance?
The initial plan for getting this out to try to get the best coverage within our community will not have any admin fees charged.
Okay. 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 And it sounds like a lot of these vaccines have 2 rounds. So
yes, we know the Pfizer vaccine, which is the one that applied today, is you have your first dose and 21 days later is the second. The Moderna, that is close second, is a 28-day for the second injection.
Do you have the supply? Don't they need a special fridge or something related to that? Do you have the equipment, or do the other? I know the healthcare systems, I think, have purchased the necessary equipment, but do we have the necessary equipment?
We are
storage.
It can be recharged with pelleted dry ice in the shipping container that it comes. Pfizer can be recharged up to 15 days. And once it's taken out, it lasts 5 days in the fridge. The Moderna, once that's refrigerated, can last 30 days. So our intent is to not have to recharge with dry ice, just because of the risk with handling that as well. So we have tried to work our throughput to try to get through our allocations within that 5 to 6 day window.
Okay, good to know. Okay. Well, I know we're right at time here, so others have questions of Suzanne? Okay. Larry, was there anything else that you wanted to anything that we can do to help?
Well, I do know that I believe there were some questions related to funding, and I know Melissa Perella, our public health accountant, has already spoke and answered some questions about funding, but I just wanted the Board of Health to have that opportunity to ask Melissa if there's any specific questions related to ongoing or current funding related to the COVID pandemic, and that's the last that I have.
This is Arlette, Larry.
Did anybody
I truly don't know what else. I truly don't know what else to ask. Are there other activities where the funding will dry up? Probably is the question.
So I can just tell you kind of where we're at. As you know, we had 8.6 million roughly. It was divided up into local public health for anything we needed, including the vaccine planning and rollout. They gave us a budget of 2.4 million. Of the task force money, which was 6.2 million, local public health was allotted 1.2. The community education and outreach was 413,000, and the quarantine support was 3.5 to begin with. Family health care center was just over $1 million. Quarantine support got redone, revamped with all the changes that have been going on. That's at 3 million. The family health care center budget, they didn't think they were going to spend it all. They're down to 565,000. Where we're at currently is on the task force end of things for local public health. We are already overspent in our budget by 300,000. That's where we think we'll end up. It'll probably be more than that. Family health care center will not spend their 500,000. And quarantine support will spend it all. Education will spend it all. Local public health, the 2.4 will not spend it all. Right now, we're at about 500,000 to 600,000 that is unallocated. But as things are changing daily, as they have been the whole entire 8 months, those numbers change right along with it. And just last week, we were at $1 million unallocated, and my last number was 771,000, and daily that drops. So I'm guessing in the end it'll be 500,000 by the time we're done. Hard to say. We have another about 40 days to go here, so before the end of December. So that's where we're at today. They want us to spend all this money, and we just don't know what the unknowns are right now. So that's where we're at with the budget as it sits today. So if there's any questions on that.
Hard to plan.
Very.
Okay. Any other questions? Okay. Well, appreciate everything that you all are doing. If you need anything from us, please don't hesitate to reach out and ask. I'm more than willing to do whatever we need to do to support you in what you're doing for the community. So
Thank you.
All right. Thanks, everyone.